Good evening and welcome to another episode of IMED, and today also we're going to take a look at a very common condition when it comes to our urinary system, which is the urinary stone disease. And to do the honors, we do have today Professor Neville De Pereira, Senior Consultant of Urological Surgery, Institute of Urology at National Hospital of Sri Lanka. Good evening to you, Professor.
Good evening.
So urinary stones, or rather here it has urolithiasis and calculi, is it all same, and what are actually urinary stones? We'll start from there itself.
Yes, naturally, as most of us know, urine is there to excrete all the waste products from our body. So naturally it contains a lot of crystals, which are kind of waste products in our body, like calcium and oxalates and phosphates and things like that. And all these things are excreted in urine, and constantly we just expel it out of our body. But on and off, when these constituents are in large amounts in urine, or you get dehydrated a little bit and then these crystal levels go up, you start forming these concretions or crystals in your kidneys. So most of the stones start from the kidney, and then they roll down, and the natural body response is to expel them out. So urinary stones are main constituents, as I was mentioning. It is calcium based, so calcium oxalates. And if I move this, if I show you this slide, you will find that there are various types of stones there, and you can see this list of names there: calcium oxalate, calcium monohydrates, phosphates, and those are the common stones. But occasionally you get these huge stones, you will see in this slide, which are called stag horns, or looks like horns of a stag. They are huge stones which occupies most of the kidney. So so you can get a range of stones forming in your kidney, and then giving all these problems we are going to discuss soon.
So those are the types of calculi as well.
Calculi.
So what can cause these kind of stones to form in our body itself?
Yes, the three main theories are that when your body get dried up, the urine get concentrated. The natural body response is to reserve water when you are dehydrated. And then the concentration of these crystals go up, and stones start forming. So that is, there's a heavy name called supersaturation. So, and the other most important reason is that if you ingest a lot of constituents of these stones like calcium oxalate in large amounts, again urine will be full of these crystals. So that's another reason. Next reason is that if urine is not flowing, urine is supposed to flow from the kidney outwards. So at any point, if your urinary tract is blocked, say at the urine tube level, or it is at the bladder level, then urine will get stagnated. So stagnated urine will form, the crystals will get precipitated, and it will start forming stones. And the last theory is that if you have dead cells, say after an infection, or maybe during a surgery, a little suture or something has gone through your urinary tract, which is called a foreign body. If there's a foreign body, it may be a dead bacteria. When there's a foreign body, around that you start forming crystals. So that is called the nidus, or the center point of the stone. So those are the three main theories behind stone formation.
Well, Professor, now one can present with a pain, low abdomen pain or some other referred pain with a stone, but what are the other presentations of a patient with a urinary stone?
Yes, when you talk about the pain, if I emphasize on that a little bit, pain is a very kind of a classical pain which we call renal or ureteric colic pain. It's a severe pain actually, and people who have experienced that would know. It comes in the loin area, and if I move on to the next slide, you will see the presentation here, and it is felt on the loin area, on the side of your body. So if you get a severe pain which comes on and off, and then which disappears for a while and then comes again, that means a stone is trying to come out from the kidney and come to the bladder. And the other, as you asked, the other symptoms are when the stone is rolling down, it scratches the surface of the water tubes, so that you might pass some blood with your urine, so red colored urine. And if the stone gets blocked, stuck in the water tube, especially in the middle part of the urinary tract, then of course the kidney will get bloated up and the urine will not go through the stone, so that stagnated urine can get infected. So with the infection you get not only the pain, you get fever and shivering, and then all the signs of infection there. So if you have a bladder stone, on the other hand, if it has dropped into the bladder, that can irritate the bladder and cause symptoms like frequent passage of urine, difficulty in passing urine, sudden blockage of passing urine, and then getting up in the night several times to pass urine. That is due to the bladder irritation, not from the kidney stones, from the bladder stones. Those are the common symptoms.
So what sort of stones will need immediate treatment, Professor? Now we see some, as you mentioned, that some stones come with presentations or signs and symptoms as such, but some stones, the smallest stones, can stay like that without presenting it with severe symptoms as such. So what are the stones that should need immediate treatment?
Yes, good question. The stones which are blocking the urinary tract, that is at some point, it's in the water tube, especially the tube which comes from the kidney to the bladder, called ureter. Those are the most dangerous stones because they can be silent. They might not make any pain or anything, because pain comes when it is moving. So if it got stuck somewhere and it's not moving, the pain will be there for a while and then it will disappear. So the patient will be happy saying that I might have passed the stone, but that is a misconcept. So the stone will silently block the kidney and ultimately kidney will stop working. So that kidney will stop working and it start getting bloated up. So that's the dangerous part of it. So you should not judge the outcome from the symptoms alone. So those are the stones which need urgent treatment. But when you come to the kidney stones, they may be big, but if they are not blocking the system, you have plenty of time to treat it. So there are various types of treatment we will be discussing soon. But there is no urgency. And on the other hand, the bladder stones, if they are irritating and giving lot of problems like frequent passage of urine and bleeding, then of course that also might need a little bit of early attention.
So why should one concern about this urinary stone disease? What is the reason?
Yes. The main problem, apart from the symptoms, apart from the trouble it is giving, is that blockage. So if the stones are blocking both your ureters, both tubes, then what can happen is suddenly you can go into a kidney failure. Because if you have one kidney to compensate, that's fine. But if both kidneys are blocked, suddenly you find that for 6 to 8 hours or maybe about 12 hours, you have not passed urine at all. You have not produced any urine. So that is called acute renal failure, acute kidney failure. So that is a problem. And on the other hand, as I was mentioning earlier, if it is getting infected, the kidneys are getting infected, repeated infections, especially in children, can damage the kidney. So it can cause scarring of the kidney. Each time you get the kidney infected, the kidney can become weaker. So that is another problem. So that's why we should be attending to some of these stones urgently.
So Professor, how to investigate early, as in like how to know whether we are in a condition like that we should take concern very soon?
Yeah. Moment you suspect that, I think the public should be aware of the symptoms first of all, as I was mentioning, urinary symptoms or loin pain, sometimes radiating or just dropping towards the front of your abdomen. If the symptoms are there, they should present early to a clinician for treatment. And then we'll be starting with, if I show you the next slide, we will be starting with some simple tests like urine tests, and blood tests to check whether the kidneys are functioning well, like what we call creatinine, and urine test to check infection and blood and pus in urine. Once that is done, to get the overall diagnosis, we will be doing a plain X-ray and ultrasound as a screening investigation to start with. But unfortunately, most of the stones, say about 50% of stones, can be missed in ultrasound and X-rays, because sometimes they are too small, sometimes they are not seen in X-rays. Though we are pretty sure that there is a stone, you might not see them. So if the screening investigations, which is shown here, you can see this. There is a plain X-ray being taken, and you can see a small stone here in the water tube stuck there. And you can see on the pointer, if you look at the pointer, there are two large stones. These are not, this is not the kidney with any dye inside that. This is just the stone. This is a plain X-ray which shows two large, huge stones. These are the stones which we call staghorns. You can pick them up in X-rays, but small stones can be missed. Or you go for this ultrasound scan, and then ultrasound will pick up some kidney stones, but it will miss ureteric stones. So ultimately, if you are suspecting a stone and if you have not found one, the gold standard of investigation is to do a CT scan. And actually the CT doesn't need a contrast or a dye. What you do is the CT without a dye. That's called non-contrast CT scan. That will pick up 99.5% of stones in the system. So as in the second round, you will do a CT scan which is shown in this third slide, and that will be the gold standard.
Right. So once the doctor identifies that there's a stone or multiple stones are present, what are the treatments that are available here for these urinary stone diseases?
Yeah. Sometimes back, it was always some kind of surgery.
Yes.
But nowadays, it is well known that if the stone is small, say if it is less than 5 millimeters, there is a good chance that it will be expelled out of the body by the kidney itself. So kidney has a pumping action, the tubes will pump urine down, so with that stone will get washed off. So that is a good thing to happen. You will get some pain, so you will need some painkillers only. But on the other hand, now there are new drugs to relax the water tube and make the stone to come out faster. So up to the size of about 6 millimeters, you can use these drugs for about 2 to 3 weeks, depending on how bad the kidney is affected. Suppose the kidney is blocked, we think it is badly blocked, then you should not try these tablets, you have to immediately attend to it. But if the kidneys are not blocked and we feel that the stone is small, is going to come out, you can try these capsules and tablets for about a period of 2 to 4 weeks. And with some painkillers, there is a good, say 60 to 70% chance that you might pass the stone. On the other hand, if the stone is big, and then if it is stuck in the water tube or inside the kidney, and you know that it is never going to come out, then you have to go for some sort of intervention. And if I show you the next slide here, unlike good old days, cutting open for a stone is now a rarity, true rarity, and it's more historical. So most of the stones can be tackled with what we call minimally invasive treatment, or without making big cuts. So out of that, the first treatment modality is shown in this slide, depicted in this slide, is the shock wave treatment, in which the shock waves are generated by this big machine there. You just lie down on that, and it's done under local anesthesia or sometimes just painkillers as a day case, no admission, no anything necessary. And we send sound waves after localizing, after seeing the stone in the X-ray, and then these sound waves will enter the kidney and crush the stone into small pieces, and next few days or week or two you will pass them with your urine. So that is fortunately that is there, but only for stones which are 2 centimeters or less. Large stones, this doesn't work because there will be a lot of pieces left inside the kidney which will form new stones. So if the stone is larger, then of course you have to move on to this third group of slides here. You have to think of keyhole surgery. If the stone is big, then you have to do it under general anesthesia. It needs about, say, hospital stay of about 2 days or 3 days. And what we do is, under X-ray guidance, we make a little puncture hole into the kidney and then go along that and put a telescope into the kidney. And then when we see the stone, we have various mechanisms to crush the stone into small pieces, like laser and sometimes various other techniques to crush the stone into small pieces and remove it through that tube. So when you wake up, the stone will be gone, but there will be only a small hole in your loin area, so which will heal on its own. So that is called keyhole surgery or percutaneous nephrolithotomy, long name. It's called PCNL, the shortened form. And most of the time, the stone is stuck in the water tube. Then you can put a tiny telescope through the urethra under anesthesia and reach the stone there and use laser fibers to crush the stone into dust. So that is called ureteroscopy. So with all these three, we have access to the whole system, all the stones. So we don't have to cut open the wall.
So Professor, once there's been done surgery or laser treatment or even medical treatment, is there a tendency to reoccur these stones in the particular patient?
Yeah, that is the biggest problem really. Not in the majority, but a minority of people, this is a problem in their genes. So it's a genetic problem, and sometimes you inherit that gene from your parents, but not in everybody. So you make one stone and then you might not form another stone for the rest of your life. On the other hand, there is a group of people who will keep on making stones every 6 months, 1 year, or maybe after a couple of years. So that tendency is there. So once you have formed a second stone, there is a high chance that you are a stone former. So you have to be under surveillance at least once in 2 years. So once annually, you have to get your kidneys checked up, because otherwise you might disappear without any symptoms. A stone might form and become really large. So recurrence, what we call the recurrence, is a big problem with stone disease because it is genetics in your genes. But once you have got the stone, if you are getting stones over and over again, there are a few things you can do to prevent stone formation. And out of that, important thing is that hydration. So as I was mentioning earlier, at least 2 to 2.5 liters of water a day will dilute urine to such an extent that you won't form much stones. But on the other hand, like all the other things, overdoing it is also pretty dangerous, because if you go over 3 to 4 liters a day, your stone forming tendency will be more, because naturally in your urine there are some chemicals which will prevent stone formation. So some proteins and things like that are there which will prevent stone formation in normal people. So if you keep on drinking 3-4 liters or gallons of water, these proteins will get diluted and the stone formation will increase. So that is advice I have to give. And other than the inconvenience of spending most of the time in the toilet, you will form more stones. So that's dangerous.
That is a very important point that you highlighted.
Yes, and also taking a lot of salt. Increased sodium levels have been shown to increase the stone formation, and eating a lot of red meats and things like that will make the urine acidic, and acidic urine will form more stones. And apart from that, taking too much of vitamin C is known to cause stone formation. On the other hand, the citrates, citric acid like lemon and citrate containing fruits are protective. So drinking a lot of water and taking citrates, high citric acid fluids are protective.
Well, Professor, since we are in the pandemic situation,
Yeah.
is there an impact on COVID or the coronavirus with the patients who are having urinary stones already?
Yeah, kind of in a big way, I would say, because about say 50% of our workload at in the pre-corona period was stone disease, because it's so prevalent. Every year we were treating about 4,000 patients a year in our unit institute itself. But remember that there are about 20 more units all over the country. So altogether there are must be about 7,000 to 8,000 stone patients are there coming to us. And out of these people, the biggest problem with the COVID impact was that identifying these people who are at risk. So as I was mentioning earlier in my discussion, some people, the stones will be silent and they are blocking the kidney, they are silent killers of the kidneys. So if the patients can be screened, so what we did was actually with the slightest symptom, we screened them and categorized them into high risk and low risk people. So the people who are having a large stone even in a kidney which is not blocked, we explain the situation to them and postpone their surgery, like keyhole surgeries. But on the other hand, if we picked up a patient with blocking stone, some or the other way we made sure that either we remove the stone or there are some shortcuts we can take, like putting a stent. There are tiny tubes which can bypass the stone and we can push it in. It's just a day surgery, and then for 6 months that stent will be there inside the body, and that will prevent the kidney getting blocked. And once the pandemic is little under control, we can always attend to those stones. So we took those measures, and first thing was to identify the high risk people and treat them.
Yes, Professor, to wrap things up, we would like to get a take-home message to all our viewers regarding urinary stone disease.
Yeah, what I can say is that don't ignore the symptoms. Like any other diseases, surgical diseases, not only kidney diseases, don't ignore the symptoms. If you get a pain in the loin, the side of the body, and if it is severe especially, it might disappear, but the disease will be still there, lingering inside you. So what you can do is that don't ignore them as soon as possible. I know there are restrictions during this COVID period, but as soon as possible, meet a clinician, maybe your family doctor, and then start getting investigated, at least the basic investigations, to find out whether your kidneys are safe. And on the other hand, be hydrated, drink enough water, not plenty of water, at least 2 to 2.5 liters, that is 6 glasses a day, to keep you away from dehydration. So once we have formed a stone, be sure that you get checked up every year or two to see whether you are going to get the next one, which can be silent and can be dangerous.
It was very informative indeed. Thank you, Professor Neville de Pereira, for being with us today, Senior Consultant of Urological Surgery, Institute of Urology at the National Hospital of Sri Lanka. Professor did brief us about the urinary stone disease, what are the symptoms, how it can cause, and also how to prevent this stone disease and what you should do, especially during this pandemic situation. Thank you once again, Professor, and we'll join up once again with another episode of iMed. Have a safe day.